If we talk about skin lesions, they are primarily divided into primary lesions and secondary lesions. Primary lesions are initial and a direct result of a disease in the skin. The secondary lesions are a development or a modification of primary lesions via an external force such as scratching or an infection. Primary lesions are divided by its characteristics, so therefore we ask questions about its characteristics and classify them. First, we talk about its elevation. If it is elevated uh, or not. If it's not elevated, then we talk about its size. If it's more than 1 centimeter, it's called a patch, and if it's less than 1 centimeter, it's called a macule. Macule can be as freckles. Freckles are macules, and patch can be found in vitiligo. So, coming back to the first question, elevations or not. If it is elevated, then we ask the next question: if it's solid or not. If it is solid, then if it's transient or not. If it's transient, then it's a wheal, and it is most commonly found in allergies and allergic reactions such as urticaria. And if it's not transient, then it's chronic. And we ask the next question about its depth. If it is deep, then it's a nodule. Nodule is around 1 centimeter, more than 1 centimeter deep, and if it is more than 2 centimeter deep, it's most likely a tumor. Then if it's not deep and it's superficial, then we ask about its size. If it's less than 1 centimeter, it's called a papule, and if it's more than 1 centimeter, it's called a plaque. Plaque can be found in psoriasis, and papule can be a wart. Okay, so coming back again to the original question, if it has elevation, yes. If it's solid, no. If it's not solid, then it has fluid in its cavity. And then we ask the next question, if there's pus or not. If it has pus, it is called pustule, and a pustule can be found in infections or most likely an acne. If it does not have pus, then it mostly likely has a watery fluid present inside it. And then we ask about its size. If it's more than 1 centimeter, it's called a bulla, and if it's less than 1 centimeter, it's called a vesicle. Vesicle can form chicken pox, and a bulla can be seen most commonly in a bone. Okay, so now we have classified the most common type of primary lesions: macule, which can be commonly seen as freckles, patch in vitiligo, vesicle as in chickenpox or most commonly in any most infections, bulle most commonly in burns, pustule as in pus uh, in infections or acne, wheal as an allergy or nodule, which is a deep, solid, chronic lesion, and if it's more than 2 centimeter deep, it's most likely a tumor, and a plaque seen in psoriasis, uh, more than 1 centimeter superficial solid lesion, which is chronic. Papule, which can be a wart, which is less than 1 centimeter, which is superficial and chronic. Now, a small co-section of secondary lesions. Secondary lesions are mainly divided into two types, which are loss of surface or surface. There are surface changes. Secondary skin lesions are mainly an avulsion of primary lesions, which or an manipulation of primary lesions by scratching or infection or any external force. So, if there is loss of surface, it becomes an erosion. Erosion can be seen in vesicle. If vesicle of chickenpox is scratched, then there are erosion and loss of surface, and also which can be seen in pressure sore, a fissure, which can be seen in athlete's foot, and excoriation, which can be seen from itching. And in surface changes, scaly surface changes can be seen in psoriasis, crust can be seen in impetigo, lichenification can be seen from chronic scratching, and atrophy can be seen with aging or any corticosteroid use or any steroid use. So here we conclude our primary lesions and also secondary lesions. So that's it, and thank you.